Hello everyone, this is Group 17's presentation on Cushing's Syndrome by Holly, Brooke, Sergina, Juan, and Brittney.
Hello, I'm Sergina Maignan, and I will be covering the background, diagnosis, and risk factors associated with Cushing syndrome. Let's start with the background. Cushing syndrome is caused by overexposure to high levels of cortisol hormone. This can be due to chronic asthma or rheumatoid arthritis medication or a tumor in the adrenal gland or pituitary gland. 10 to 15 million people are affected every year. Demographics most affected are 20 to 50-year-olds, and this is more prevalent in females. This illness was named after neurosurgeon Harvey Cushing's. Cushing syndrome, produced by a benign pituitary tumor, was first definitively described in 1932 by Dr. Cushing.
Hello, my name is Juan Ruiz, and I'll be presenting physiology and how cortisol works in the body. So what is cortisol? Cortisol is one of the main glucocorticoids, otherwise known as steroids, produced in the body. It is released from the adrenal cortex, and it is a hormone with a variety of functions. So let's go through a couple of them. One of the main functions of cortisol is keeping the fight or flight alert, or our sympathetic nervous system. We find the highest amounts of cortisol in the body in the morning, and that's why we see a decreased amount of melatonin and serotonin, because we want to be awake and alert. It also is important in aiding in raising blood sugar levels throughout the day via gluconeogenesis, making glucose from sources such as proteins and fats, and is also important for dialing back the body's immune response. In the case of asthma, too much inflammation can lead to respiratory distress, so the body releases cortisol to lower the inflammation. In the cases of rheumatoid arthritis, when the body is destroying its own cells, cortisol inhibits cytokines such as interleukin, TNF, and INF to prevent any further damage. Receptors for cortisol are found throughout almost every cell in the body, so you can imagine it playing such a wide role. It is important to keeping levels where they need to be. I'm going to pass it on to Brooke, where she's going to talk about pathophysiology and where we run into some of these problems.
Hello, my name is Brooke Kish, and I will be presenting the pathophysiology associated with Cushing's syndrome. Today we are going to primarily focus on the hypothalamic pituitary adrenal axis, also known as the HPA axis, with its associated hormones. First, we are going to have a stressor that will act on the hypothalamus, stimulating the release of corticotropin releasing hormone, also known as CRH. CRH will then go to act on the anterior pituitary, causing the release of adrenocorticotropic releasing hormone, also known as ACTH. ACTH will then go to act on the adrenal glands, stimulating the release of cortisol. Cortisol will then act on the body to inhibit immune system function, inhibit bone formation, increase blood glucose levels, increase metabolism, and increase alertness to response of that stressor. Forms of Cushing's involve endogenous and exogenous forms. Endogenous meaning within the body, and exogenous meaning coming from an outside source. First, we are going to go over a pituitary adenoma, also known as a pituitary tumor. This tumor will increase the production of adrenocorticotropic releasing hormone. From there, ACH will go to act on the adrenal gland per usual, stimulating the release of cortisol. Cortisol will then, of course, go on to act on the body by inhibiting immune system function, bone formation, increase of blood glucose levels, metabolism, and alertness. From there, we will discuss how the adrenal gland tumor will also increase the release of cortisol, in turn causing an increase of all the things associated with cortisol. Next is an ectopic tumor, meaning somewhere outside of the HPA axis there is a tumor. A prime example of this is simple cell lung cancer. Simple cell lung cancer will then act on the pituitary to increase production of ACTH. ACTH will then, of course, act on the adrenal glands, stimulating the release of even more cortisol. Next is exogenous or iatrogenic, meaning coming from an outside source. So iatrogenic means medications that someone is taking used to prevent previous ailments causes a new ailment. So medications with cortisol, such as used in asthmatics and people with rheumatoid arthritis, also increase cortisol levels within the body and, of course, increase all of those other things associated with cortisol. There is an additional classification system associated with the pathophysiology of Cushing's syndrome. There is ACTH independent and ACTH dependent. ACTH independent will raise cortisol levels, while as ACTH dependent will raise ACTH levels. ACTH independent forms of Cushing's are often caused by use of steroids, while as ACTH dependent forms of Cushing's are often caused by Cushing's disease itself from pituitary tumors or ectopic tumors. It is important to note that more often than not, causes of ACTH-independent forms of Cushing's can be reversed.
There are multiple diagnostic tests done to diagnose this illness, as shown in the diagram to the right. 24-hour urinary cortisol test measures cortisol production in the urine over a course of a day. Levels higher than 50 suggest the presence of Cushing's syndrome. Low-dose dexamethasone suppression test requires taking the small dose of the cortisol-like drug, then having blood drawn to screen for cortisol the following morning. For patients with Cushing's syndrome, cortisol levels will be high. However, it's still difficult to fully diagnose with this test as there are loopholes. So then we move to the late-night salivary cortisol test. This test examines overproduction of cortisol levels in the saliva overnight. Follow-up tests are MRIs of the pituitary gland, but 50% of patients could still appear normal with the MRI. So a more definitive diagnostic test after all these is petrosal sinus sampling.
Hi, I'm Brittney, and I will be covering the risk factors and effects. People ages 25 to approximately 50 years old have a higher risk of developing Cushing syndrome, which also affects about 3 times as many women as men. Other risk factors include obesity, type 2 diabetes, poorly regulated blood glucose levels, and hypertension. Taking cortisol medications for long periods of time has also been found to increase the risk of developing Cushing syndrome. The symptoms of Cushing syndrome in regard to the whole body include excessive sweating, hairiness, hunger, fatigue, flushing, high blood pressure, and even osteoporosis. When looking at the skin, we can see abnormal pads of fat between the shoulder blades, acne, darkening of the skin, stretch marks, and overall skin thinning. Muscular symptoms include weakness and loss of muscle altogether. Other common symptoms include anxiety, depression, easy bruising, hair loss, headaches, infertility, insomnia, irritability, a pot belly, a round face from gradual swelling, swelling in the extremities, or weight gain. Weight gain in the face is also known as a moon face, and weight gain between the shoulders is also known as a buffalo hump.
There are several effects associated with this illness, including osteoporosis due to increased glomerular filtration rate and excretion of calcium and decreased absorption of calcium from the intestinal tract, hypertension due to increased salt and water retention, infection due to decreased production and circulating levels of antibodies by lysis of plasma cells and lymphocytes, diabetes mellitus due to cortisol increasing blood pressure and blood glucose levels, hypokalemia due to increased secretion of potassium and hydrogen ions, peptic ulcer disease due to increased production of hydrochloric and pepsin and decreased gastric mucus production, and kidney stones due to high levels of cortisol affecting the kidneys.
Hello, I'm Holly. I'll be covering prognosis, treatment, and some interesting facts. Prognosis depends largely on if you're treated and how soon. The earlier you're treated, the better. The figure on the right illustrates how persistent issues associated with Cushing syndrome are. Those in remission generally still have a higher BMI due to fat, a higher blood pressure, and report anxiety and depression more frequently than the average population. They are also more likely to develop autoimmune diseases. For example, 35% of the cured patients will develop a type of thyroid autoimmunity versus 10% of the general population. Due to the risks associated with Cushing's and the potential for reoccurrence, long-term monitoring is recommended. Despite this, those who receive treatment have a life expectancy similar to the average population. Untreated, Cushing's leads to heart disease and atherosclerosis. Half of people with untreated Cushing syndrome will die within 5 years. The figure on the left outlines additional issues associated with leaving Cushing's untreated. Treatment is essential. If Cushing's is left untreated, it can be fatal. The most common cause of Cushing's is overuse of glucocorticoids. If this is the case, your doctor will want you to stop steroid use and either have you take a smaller dose or switch to a non-glucocorticoid medication. Until symptoms are gone, you may be prescribed a corticoid inhibitor such as mitotane or meteropone. Pituitary tumors, called adenomas, are the second most common cause of Cushing's. Surgical removal of the tumor is preferred treatment as it can cure patients and is done through the nose as non-invasively as possible. This is called a transsphenoidal surgery, and it can be seen in the top left image. Recurrence of these tumors is common, and future surgeries are likely. Radiation therapy is another option, but there are many risks associated with using it long term. It is more frequently used in combination with surgery to help prevent recurrence of tumors. Adrenal tumors are also preferentially removed by urologists. This can be seen in the bottom left image. A bilateral adrenalectomy, which is a complete removal of the adrenal glands, may be needed if there are multiple tumors or cancer. This requires lifelong hormone medications to replace gland function. Ectopic ACTH-producing tumors are commonly cancerous, and removal may be accompanied by cancer treatments. Until fully healed, all gland surgeries are usually followed by corticoid medications such as prednisone or hydrocortisone to replace the corticoids the gland would normally produce. Lastly, we have some interesting facts about Cushing's disease. Dogs, cats, and horses can have Cushing's disease. However, it is most common in dogs. Specific dog breeds are more at risk. Addison's disease is essentially the opposite of Cushing's disease and is associated with low levels of corticoids. It can also be seen in animals, but not as commonly as Cushing's. Despite the manifestation being similar to that of humans, animals rarely receive surgical removal of tumors and are instead medicated. Pituitary tumors are the most common natural cause of Cushing's in both humans and animals.